Labiaplasty is an operation to change the size, often to reduce them, or the shape of the labia, which are the skin folds at the entrance to the vagina. Labiaplasty can be performed for cosmetic reasons, but I would mainly perform them either to repair a problem after childbirth if the labia or vagina hadn't healed properly and had left a degree of scarring or pain, or also for a functional reason. And so women who wear tight clothing, perhaps cyclists, gymnasts, or other sports people, or if the shape or size of the labia interfered with intercourse or with wearing clothing. It can also be performed for people who spend a lot of time riding horses, as sitting on enlarged labia can also cause a significant degree of discomfort. Many people do ask if labiaplasty can help with yeast infections, but unfortunately it's not something that would tend to help. Yeast infections are very common, and there are a number of strategies that can be used, both in terms of personal hygiene and also using over-the-counter medications. If yeast infections were to become a problem, then there are longer courses of treatment available, and these would need to be discussed with either a general practitioner or a gynaecologist. It's very important to note that normal has a very wide range, particularly when it applies to the vulva. And some women are told by colleagues in a changing room or by a partner that things look abnormal, and often all that is required is an examination or a consultation with a gynaecologist to reassure that everything does look normal, and indeed there is absolutely nothing wrong. If there are any functional problems, such as getting the labia caught on underwear or sports clothing, then we can have a discussion about how much skin can be removed and what the resulting labia might look and feel like. Once the diagnosis is made and the decision to perform surgery is made, then it's normally carried out under a general anaesthetic, because the labia can be quite a sensitive area. Once the patient is asleep, a further examination takes place in theatre, and a small area of skin is excised from the labia, and then some very fine sutures are placed to ensure that the edges heal appropriately. Those stitches normally dissolve, so they don't need to be taken out afterwards, and there's often some local anaesthetic used as well during the operation, which will help with pain release post-operatively. Sometimes a small dressing is placed as well, and it's normally done as a day case, so you would normally go home on the same day as the operation being carried out. So once you go home following a labiaplasty, there may be a degree of discomfort, and simple pain relief should be all that's required to improve this. The area should be kept as clean and as dry as possible, and healing should start within the first couple of weeks to be able to resume normal activities. Things like intercourse, where obviously the repair could become disrupted, should be delayed a little bit longer than that, and I would normally advise leaving at least 4 to 6 weeks post-operatively before resuming sexual intercourse.